Hi, my name is Lexi Huitt, and I'm doing my presentation over the effects of prematurity on physical development. In this presentation, I will explain the common causes of prematurity and how prematurity affects the physical development in infancy and childhood. I will also describe some of the diseases caused by babies' physical problems because of being born prematurely. When is a baby considered premature? A baby who is born when the mother is less than 37 weeks along in her pregnancy is considered premature. When they know that the baby is going to be born prematurely, they will do certain measures to help it develop faster because they know that prematurity causes a lot of problems. A full-term pregnancy is considered 40 weeks or a little over 9 months. If you deliver at 37 weeks or after, your baby is no longer considered premature. Usually there's an age of viability, and that's 24 weeks for a baby, that they would think that it could even survive. Before 24 weeks, it's not likely that they would, which is really sad, but there's nothing they can really do at that point. Having a premature baby puts you at risk for delivering early in other pregnancies. So if you decide to have another kid, you have more of a chance to deliver and have them early, just like you would on your other pregnancy. Or if you have multiple babies, say you were having twins, that's another risk that is really when you have premature babies. There's a lot of problems that you could have during your pregnancy which could cause it too, but those are some of the risks. When a baby is born prematurely, it is at risk for many health problems. And like I said earlier, the age of viability is 24 weeks. The first thing I'm going to talk about for physical development is the lungs. Babies' lungs are not fully developed until about 36 weeks. Before that, they can give the mother steroids or something to help make the lungs more mature. The lungs are one of the very last organs to develop in your baby. Prematurity is the #1 cause of breathing disorders. The R in APGAR, we learned about this in our book in one of the previous chapters. It's for respiratory. Usually a good APGAR score is about 7 or 8. Above that's really good. 7 or 8 is usually the minimum that they would consider a healthy baby. A low APGAR score can indicate many problems with your baby. The nervous system controls the newborn's breathing, so if they're premature and their nervous system isn't completely developed, they will have some issues breathing. One of the things that they could develop is respiratory distress syndrome is very common in premature babies because their lungs are underdeveloped. When the lungs are underdeveloped, they're lacking surfactant, which helps their air sacs stay inflated, so it's easier for them to breathe. Some long-term effects on physical development because of prematurity of lungs is asthma and bronchopulmonary disease. These effects are very dangerous and can last their entire lifetime. This is an example of a picture of preterm lungs compared to term lungs. As you can see in the first picture, they're really underdeveloped, and that's 24 to 35 weeks, so until they reach the age of 36 weeks, their lungs aren't going to be completely developed, so it's really hard for them to breathe when they're at this point. There are some things we can do to help the baby's lungs mature. In some cases, doctors perform what is called an amniocentesis, where they take the sample of the amniotic fluid to detect a problem in the fetus. So this is done way before the baby's going to be born. It can detect many problems, not just lung problems. It can be any types of diseases that they can detect with amniocentesis. They take a sample of the amniotic fluid, and that can tell them if they're going to have any problems. And one problem that we're focusing on is the maturity of the baby's lungs. If they're expecting a premature birth, it's more likely for them to do an amniocentesis than if they're expecting a full term. So if they already know that you're having problems with your baby, they're most likely going to do an amniocentesis. But there's also like problems that you can have with that. It can cause you to miscarry, which is really not common, but it can happen. It can cause like problems with your baby's organs, or like their legs or anything could go wrong. But it's the safer, in my opinion, it's safer for you to get one and know what's going to happen than to not get one and just worry. When you know that your baby is going to be premature, doctors will give the mother antenatal steroid treatment, which help the baby's lung develop more quickly. If a baby's lungs are underdeveloped, they could experience breathing problems for the rest of their lives. The second problem that I'll talk about for the physical development is weight. A baby who's born premature weighs less than 5 pounds 8 ounces. Babies who are born prematurely surprisingly have a higher risk of being obese later in life. Babies who are deprived of nutrients before birth may have long-lasting problems with organs such as the liver and the pancreas. When the fetus is being malnourished, they try to absorb all of the nutrients that they possibly can. When the baby is born, they still fight to get the nutrients that they need. Babies who are born prematurely, their brain is programmed to eat more because they develop less neurons in their brain to tell them when they're full. Babies who are born prematurely try to catch up to a normal weight, but often find that they are obese by the time that they hit adulthood because they are taking in too much nutrients, because the brain can't tell them when they're full, so they'll overeat, which is a really big problem. Because their brains were programmed to eat more as a baby, it is hard for the brain to realize when they have had enough nutrients, which causes overeating. These are problems with the physical development of the intestines if you're premature. As many people know, babies who are born prematurely have a risk of developing an infection or illness. They're more at risk than normal, like healthy babies who are born at when they're supposed to be. Than the premature, they're really at risk for infections. One infection related to the intestines that occur in preemies is called necrotizing enterocolitis, which is abbreviated as NEC. NEC is when the intestinal tissue becomes damaged and starts to die. If you've ever seen Grey's Anatomy, this is like a really big show, and they show a lot of preemies, and in some of the preemies you can actually see the dead tissue, and it's really sad because it does happen. NEC can be treated, and most premature babies can fully recover, but there are some that have ongoing physical problems because of it throughout their lives. Some long-lasting effects of NEC is a narrowed bowel, which can cause an intestinal blockage. It's dangerous to have an intestinal blockage because once the food gets all backed up, it can cause the intestines or the bowel to rupture, which can cause fluids to leak. And if you've ever heard of feces in the stomach, that can cause problems with the mother and the baby. It can make both of them really sick, so you don't want that to happen. Harmful bacteria into your abdominal cavity is very serious. You don't want to deal with that. Another long-lasting physical effect is malabsorption. This is when your bowel is prevented from absorbing nutrients that can be caused by an injury to the lining of the intestine. Some babies that are premature develop this because of the surgery. They had to repair their intestines, so like With NEC, they're going to have a surgery to repair their intestines because it's dead flesh and you can't use it once it's in there, and it can cause bigger problems. So they'll do surgery to remove this, but this can cause malabsorption. And this is a picture of a premature baby with NEC. As you can see that it's really bloated, and that's how one of the really big signs that your baby has it is because they're bloated and it feels like their stomach is really hard, and it's sad because like until they have surgery it won't go back to normal, and most times after surgery they're going to have a huge scar and they're going to have to live with it. Physical development of eyes and vision of preemies. One long-lasting problem premature babies have with their eyes is called retinopathy of prematurity, or ROP. ROP is when the infant's retinas aren't fully developed before birth and they have trouble developing after their birth. Babies with severe ROP can cause vision problems or even become blind for the rest of their lives because their retinas aren't completely developed. If a baby is born prematurely, their eye vessels could stop growing completely, or they could rupture, which could cause bleeding in the eye. If this is not treated quickly, the bleeding will cause the blindness. ROP can also cause the baby to have a lazy eye or crossed eyes. Babies born before 30 weeks are more at risk of developing ROP. Another problem caused that you have with physical development in preemies is congenital hearing loss. When your baby's born, no matter what the age, they're tested for this loss. Once you have a baby, they'll test the baby to see if it can hear. Premature babies are the most likely to develop hearing loss because their eardrums are not fully developed when they're born. I have a cousin who was born prematurely. She was born about 30 weeks. She came out and at first she couldn't hear, but luckily she can hear just fine. It was just after the birth it was kind of hard for them to tell. But a week later they took the test again and she was perfect. Some babies never recover from the hearing loss and are deaf for the rest of their lives. This only happens in the most severe cases of congenital hearing loss and sensory neural hearing loss. Sensory neural hearing loss is where the inner vessels of the ear are damaged. It's also caused by prematurity. The last physical development that has problems is your teeth, your baby's teeth. They're at risk for having many dental problems throughout their life. Some common dental problems that they have are delayed tooth eruption and tooth discoloration. Delayed tooth eruption is when they're going to get their teeth 2 to 6 months after a normal delivery would have their teeth. So like babies start getting teeth around, I would say like 5 months. They wouldn't have it until 2 to 6 months after the normal baby. They're also at risk for enamel hypoplasia, which is when there's a lack of enamel on the outer covering of the tooth. The smaller the baby is, the more likely it will be to develop these problems. This is an example of the enamel hypoplasia. Many premature babies develop this. It can also be developed from your mother being sick while you're in the womb. I actually experienced that when I was born because when I first got my first teeth, they were eroding, so they were discolored, and I had to get a bunch of crowns to fix it. It was not fun for me because in all my baby pictures and like pictures throughout my life up until kindergarten, I had this tooth discoloration, and now I look back on it and I'm not really embarrassed about it because I knew that it wasn't my fault, but it can happen to anyone. As you can see, there's a lack of enamel on the child's teeth. Some things you can do to treat this condition. It's not permanent treatment, but you can get sealants, bonding, or crowns. I had the crowns. It made your teeth look like normal teeth. Most of the time when the childs lose their baby teeth, the new teeth will come in and they'll be perfectly fine. As you can tell from this PowerPoint, there are many problems that a premature baby can have. Some examples of these problems included are lung problems, intestinal, weight, hearing, and dental problems. This research really opened my eyes because I'm planning on working in the NICU for my nursing degree, or OB, so I'll be working with babies. That's why I chose this topic, because I really love babies. But it really opened my eyes to see all the problems that I would come encounter with. I hope this presentation has been very useful and you'll get a better understanding of prematurity and its development.